Assalamu alaikum students. Today our topic under discussion is another viral infection, especially of bovines, and it is known as bovine virus diarrhea or bovine viral diarrhea (BVD). It has two biotypes and two genotypes. It's a contagious disease transmitted in bodily fluids, and it causes a wide range of clinical symptoms, cause marked suppression of the immune system. The biotypes of BVD, this type does not affect the immune response, and they are of cytopathic and non-cytopathic. The cytopathic kill the cell in the tissue culture and arise from a virus mutation, whereas most common strain in vaccine. In vaccine, this cytopathic strain is used, and then we have a non-cytopathic strain does not change culture cells and most common biotype found in the nature. Then we have genotypes of BVD type 1 and type 2. The type 1 is the original strain of the BVD that were isolated and is included in all BVD vaccines. And then we have the type 2. This type was more recently discovered and hemorrhagic syndrome strains and is included in most BVD vaccines now. There is some cross protection with the vaccine between type 1 and type 2. The genotypes may share the immune protection response from one genotype to other. Then the transmission of the virus. The virus may be present in various secretions and also in semen, and spread by direct and indirect contact. The mode of infection is by ingestion and inhalation. So here is a pictorial display of persistent infection spread. Here you can see that the persistently infected carriers are non-immune, non-vaccinated, and pregnant less than 5 months of the age. This is a cow which is infected by the BVD virus, and it becomes positive for the infection, and the cow along with the fetus. But the cow cleared the infection, and the newborn which comes out, the calf is persistently infected now. Now the persistently infected calf constantly shedding the BVD virus to the herd mates. It will shed the cow and the calf that may both develop acute infections. Cow may suffer from the infertility. It will transmit to the bulls that may become acutely infected and then expose cows while breeding. Through semen it can transmit the BVD virus. Then the pregnant female whose fetus may become infected, and the calves exposed to the PI calf may develop pneumonia and diarrhea. Now coming toward the pathogenesis. In pathogenesis, infection is via oropharyngeal route with primary replication in the epithelium of the oropharynx and a rapid uptake in the drainage lymph nodes. And then viremia involves infection of lymphocytes giving rise to leukopenia and spread to other lymphoid tissues, particularly Peyer's patches. Coming toward the clinical signs, that 70 to 90% of the infections are subclinical. But with the clinical signs, it shows pneumonia, fever, rhinitis, diarrhea, oral and gastrointestinal ulcers, immune suppression, and in the pregnant females it causes abortions and stillborns and birth defects. Here you can see some lesions of this disease. The oral lesions the ulceration of the gastrointestinal tract. Here you can see the abomasal ulcers. Concurrent replication in the epithelium of alimentary tract result in discrete erosion, which in the oral cavity cause excessive salivation, and in the small and large intestine induce diarrhea. Lesion in the nasal cavity and conjunctiva may also occur and be associated with discharges. Occasionally concurrent respiratory disease occur in case of BVD. Coming toward the diagnosis, for the diagnosis we use different techniques like ELISA, immunohistochemistry, and PCR technique, and virus isolation. Coming toward the treatment, currently there is no treatment available to cure bovine viral diarrhea. Antibiotics can be used for the secondary infection, but we can go for the control of this disease through vaccination and the prevention by different techniques. Vaccination with using type 1 and type 2 strains and modified live vaccine create a stronger, more natural immunity, is also cheaper and less doses required of that vaccine. And never newer vaccines have label claims that if given to cow pre-breeding can successfully prevent PI, persistent infection in fetus. And then in the prevention and control, test your herd for PI calves and remove all the animals to quarantine. Test all dams for PI calves, and then test all purchased breeding animals before entry into the herd. This was all. If you have any question, you can ask me.